Let's start.
Okay, sir. Good evening, everyone. Today, topic of my presentation is diagnosis and management of chronic GVHD. Everyone can see my screen?
Yes, I can see it. Yes.
So, what we will be discussed today: introduction of the GVHD, pathophysiology, risk factor, protection factor, clinical manifestation, diagnosis and treatment, and nursing management. Introduction. GVHD is the complication that can occur after a stem cell or bone marrow transplant in which the newly transplanted donor cells attack the transplant recipient's body. And there are two types of GVHD, acute GVHD and chronic GVHD. Chronic GVHD may be an extension of acute GVHD or may occur on its own. And pathophysiology of the acute GVHD pathophysiology of acute GVHD begins with the damage to the recipient epithelial lining as a result of chemotherapy or infection, which result into the release of endotoxin from the bacteria, leading to the activation of macrophages. Macrophages in turn to activate the dendritic cell of recipient, which when combines with the donor alloreactive T lymphocytes results into the proliferation of these lymphocytes through the release of inner lincoln 2 and the interferon gamma. And alloreactive T cell during the affecting phase damage the recipient gut, skin, epithelial, the liver cells, rapidly dividing cells of the gut, skin, and liver, leading to the acute GVHD. And this acute GVHD extend to the chronic GVHD, and chronic GVHD mainly characterized by the immune tolerance mechanism affecting the innate and the adaptive immunity. Both autoreactive and the alloreactive donor-derived T and B cells play a very important role in the GVHD. This diagram shows the this diagram shows that due to the damage of thymic epithelial cells, there are multiple epithelial cells which chronic GVHD manifestation occurs. Damage of thymic epithelial cells by the acute GVHD and proliferation alloreactive CD4 T lymphocytes, immune deviation of these T lymphocytes, which result into the macrophages activation and the tissue fibroblast proliferation, which are in the second loop. The donor mature T lymphocytes activate the autoreactive B cells, which result B cell activation and dysregulation. So both these mechanisms are the manifestation of the chronic GVHD. While the chronic GVHD is the different tissues, which mainly is the contribute by the tissue fibrosis and the antibodies deposition in these tissues. And these due to these antibodies and deposition of these tissues which target these organs that are the skin, eyes, oral mucosa, liver, GIT, genitals, lungs, joints, and fascias. And this in this picture you can see that the graft versus host disease affect the Zika syndrome of the eye, esophageal tissues, cardiomegaly, myositis, nausea, vomiting, and diarrhea, joint stiffness, and neuropathy, thrombocytopenia, and nephrotic syndrome, and in the renal on the renal damage, transmittance, and the bronchiolitis. And what are the risk factors? Risk factors can be in the donor due to donor and recipients also, and related, unrelated, HLA mismatch, sex mismatch, aluminization, and source of stem cells. And while in the recipient age, conditioning regimen, and splenectomy. And the protective factor in the due to the chronic GVHD patient have a low rates of the reoccurrence of their underlying malignant diseases, and the survival of patient transplanted for the malignant diseases developing mild chronic GVHD. And what these GVHD on the eye, the pruritus one, the initially symptomatic, the liver involvement, anorexia, weight loss, followed the rarely by the hepatic coma, diarrhea, and pulmonary and obstructive lungs disease with symptom of wheezing, dyspnea, and chronic cough that is usually non responsive to the bronchodilator therapy. Neuromuscular, generalized or the facial weakness, neuropathic pain, vision loss, muscle cramps, or in the joints, arthritis. These from these picture you can see that. And overall grading of the organs GVHD, we can score that overall severity of GVHD and the mild, moderate, and severe, and which when we see the number of involved organs, we can divide into in the mild 1 to 2. We will be considered in the mild, while more than 3 moderate, and the more than 3 and the also severe. And severity of the involved organs can be the mild, moderate, and severe, and it include in the lungs as well. And from organ scorings, GVHD, we have the Kornasky scale and Nancy scale, where we see that the asymptomatic and fully active, we score in 0, while symptomatic, fully ambulatory but restricted only in the physical severity, we will score in 1, and symptomatic limited self care more than 50 of the walking or in the bed, we will score into to the 3, while in the skin we will we will see the body surface area, and according to body surface area we will characterize into that number score, why if 1 to 18%, it will be in the score 1, while 19 to 50%, it will be considered as in score 2, while more than 50, it will be considered in the score 3. And what we will be check, and we will observe many popular rash, arrhythmias and Lynch brains, leg frames, sclerosis, and sclerotic features. And by this picture, we will score like 9 rules of nines, and 9 and 9, neck and head 9, 18 and back 18%, and both arm 18, and one leg 18%, and second leg 18%. We will be considered as a rule of 9, also applied in this for scoring. You can see in this picture, skin is involved, we will score accordingly. And by the in mouth, we will see that if there is no symptom, it will be in the score 0, while mild symptoms with the disease sign but not limiting oral intake, that will be considered as a in score 1. While severe symptom with the disease signs and on examination with the major limitation of oral intake, that will be characterized in the score 3. While in the eyes, if we see that there is the no symptom, that will be in the score 0, while mild dry eye symptom not affecting the as requirement of the lubricant eye drops, that less than 3%, that will be in the score 3, while severe dry eye symptoms significantly affecting daily life, that will be in the score 3. While GIT, you can say that if there is no symptom, that will be in the score 0, and if the symptoms with the significant weight loss, and that will be in the scores 1, and symptoms associated with the significant weight loss more than 15%, and requires a nutrition supplement, or must most calories needed, or esophageal dilation, that will be in the score 3. While liver, you can say that if that bilirubin and ALT is less than 3, that will be in the score 0, while normal and total bilirubin ALT more than 3 to 5, that will be in the score 1, while elevated total bilirubin more than 3 mg per deciliter, that will be included in the score 3. While in the lungs, in score 0, there is no symptom. In the mild symptoms and shortness of breath after the climbing 1 flight to or steps, that will be in the score 1, and moderate symptoms, shortness of breath after walking on the flat ground, that will be in score 2, while severe symptoms, shortness of breath at rest requiring oxygen, that will be in the score 3. And while in the joint, there in the score 0, no symptoms, while the mild tightness of the arm or legs, that will be in score 1, and decrease the range of motion. That will be also in the score 1, while the contraction with the significant decrease of while that will be the decrease the range of motion, that will be in the score 3. And geni- genital tract, that will be in the mild no signs, and in the score 1 mild signs, and females are with or without the discomfort on exam, and in the moderate signs and maybe have a symptom with the discomfort on exam, that will be in score 2, and the severe sign with or without symptom, that will be in the score 3. And what is the treatment? Treatment of in the that will be the systematic treatment, mild and chronic GVHD, topical steroids, and use of steroids, moderate or severe chronic GVHD, and pediatric transplant, use the phenolate and as the secondary agent, azathioprine and thalidomide. Second line treatment, these are the name of drugs which use in the second line treatment. And what is the main role of nurses in the to observe the GVHD, and what nurses will be assessed for the alter integrity, body image, nail integrity, monitor for the infection. And what will be the nursing management? Promote the skin care, administer hydrate lotion, pain medication, antibiotic and topical medication, give immunosuppression therapy and obtain drugs level as the indicated. Use clear nail polish to strengthen nails and prevent the breakage. Encourage frequent nail cares. Consult the dermatology, and educate on sun damage and use of the sunscreen. Promote range of motion, exercise, support the alter body image, and give the multidisciplinary team support. For oral mucosa, what will be the nurse assessment? Assessment, she will be assessed the intake, alter taste, anorexia, increase the sensitivity to the acidic or spicy foods, oral pain, oral infection, ability to open the mouth. And nursing management, incident of the ocular chronic GVHD in those with the 65% to 80%. Presentation initially may have the excessive tearing, burning, or guilty sensation, Sika syndrome, photophobia, corneal abrasions, pseudo membrane formation may lead to the blindness, and cataracts and the scaring may occur. And nursing assessment, ability to for the eyes to tear, need for the persistive free artificial vision change, pain or guilty sensation. And what will be the nursing management? Assist and instruct the family with the ophthalmic medication, give the immunosuppressant, obtain indicate levels, prepare the patient and family for the Shikrim test, educate the patient and family, discuss therapeutic treatment, and drops and lubricants, puncture plugs and sutures, protective lenses. And in the liver, she will assess the jaundice, hepatic size, right upper quantum pain, skin irritation associated with the hyperbilirubinemia. And what will be the management in the administer the immunosuppression, avoid the hepatic toxic agent, send the necessary laboratory test, prepare for diagnostic testing, provide skin care. And for lungs, what she will be assessed: breath, color, dyspnea, cough, oxygen saturation, activity intolerance and fatigue, inability to complete the activities of daily living, and infection. And these are the range of motion what she will be observed. And at the last, we will how we can be improve the quality of life which the patient suffer in the GVHD after transplant. Quality of life is severely compromised in the chronic GVHD. Physical, sexual, and social functioning is also lower with the higher rates of the depression and anxiety. So a nurse can assess the all these their issues and solve the problem, and she can impact the psychological morbidity, and she framework enable patients to express their concern, and the nurse will the help, and nurse is the one who can help and manage this issue as well, first of all. Thank you for listening. Any question?
No, for me. Thank you very much.